just using a template, although I can find the port usually very easily. Template often makes it easier to find.
How many years have you been doing this?
About 10 years.
The technology's been around for that long.
It's been around longer than that. It was around before I even started doing them. So I think these pumps have probably been around since the late 1990s, maybe.
What is the purpose of using 3 swabs of iodine?
That's very interesting. I think there were some studies in infectious disease that came out years ago, and they used 3 swabs and showed that 3 swabs appropriately sterilize the skin. So from then on, everybody always does 3. Whether you can do it in 1, I don't know. Probably.
I can't really imagine there's any more disinfectant on 3 swabs than on 1 or 2.
That's a good point. But everybody uses 3, no matter where you go. So for those patients that want it, I use a little drop of lidocaine with a 30 gauge needle.
A small pinch. So there are patients that do not ask for Novocaine or anything like that?
There are some patients that prefer not to have it. They just don't like it, so that's fine. I would say it's about 50-50. What I often notice too is with the little kids that have pumps, they just get so anxious and worked up over the whole procedure. I often find it easier to go without the Novocaine because then you're coming at them with 1 needle instead of 2. But it depends on what the patient prefers.
Now, for my personal liking, I know that I like the Novocaine, but do you think that the pain would be that much more significant without it?
No, because it's a fairly fine needle, and your pump is rather superficial. So we should be able to access the port pretty easily, even without the Novocaine. There are some pumps that are placed kind of obliquely in the skin, and they're more difficult to access, and for that reason, oftentimes with those patients, the Novocaine is, I usually recommend it for them because it's not as, the access isn't quite as straightforward. With yours, though, I think we generally get in very quickly.